Hi, my name is Jae-hee Neo and I am a pharmacist. I graduated in 1980 and currently I'm taking some time off to study functional diagnostic medicine. I remember before I got married, my fiance then, who is now my husband of 38 years, commented to me, "You know, when I'm studying engineering, if there's a problem, engineers try to get to the root of the problem and fix it. But it seems to me that in medicine, one has a symptom, then one gets a drug for that symptom. And there's not going to the root of the problem." Well, at that time, I had no comment to reply back to him, and I've been thinking about that for years. Well, now I am so excited to present to you a functional medicine and explain to you what that is. A functional medicine practitioner who can be a medical doctor, a chiropractor, naturopathic physician, nurse practitioner, physician's assistant, and even a pharmacist like me can help find the root of the problem where patient can experience healing. Since I'm a student of functional medicine, I don't have any patients yet. So I borrowed a patient. I borrowed a case study from Dr. Vreeland, and you can find him at vreelandclinic.com. And we won't get to this patient case study until we're done with this diagram here. We will study how GI tract, which I'll call gut, and brain is in, they have a message that goes back and forth and they affect each other. And the GI tract is basically the external environment in comparison to the rest of our body. We eat food, it goes into our mouth, it gets processed, and the nutrition is given to the blood system in our body, and the waste goes out through the bottom. Okay, and now when does a gut, before I go to that one, just to give you a picture of how large a gut is. The gut average is about 2,100 square feet. That is about size of a tennis court. So if you can imagine 2,100 square feet filled with bacteria covering the whole area. And this is the gut. Just remember that it's a large area that needs to be protected, and only food, the nutrition needs to get out of gut into the system, and everything else should be shut in until it's eliminated. Okay, so how does your gut microbiota, which means the bacteria that resides in your gut, how does it change from good to bad, or the balance is tipped from mostly good to maybe mostly bad? Okay, so it's by stress, dietary, or environmental triggers. So let me go through some of them more in detail. Lack of exercise is a stress, as well as too much exercise. Infection is a stress, mental stress, and physical stress. An example of a mental stress would be if your loved one would have been killed or died or in an accident. That would be tremendous stress. Physical stress, that would be if you were in a car accident, that would be a tremendous stress on your body. Environmental stress. We all know that if you were to live by mountains and the sea, that is a good environment. And we also know that if we live in the midst of very polluted city, that's not a good environment. Then there's chemicals and medications like NSAIDs, which everybody in US takes them to take care of pain and inflammation. And they are notorious for killing off good bacteria. But there are ways to alter that, so even when you have to take it, that you can still protect your good bacteria. And we'll go about that a little later. And then there are dietary factors, such as You can be allergic to certain food that could be detrimental to you, but you don't know about it and you continue to consume it. Some of them are like allergy to gluten, which is very common today, and allergy to milk. And so a lot of times people could be allergic to those two, and they love bread and they love milk products, and they continue to consume them. And of course, alcohol is very harmful for the gut microbiota. And bad diet. Unfortunately, Western diet and American diet even more is extremely bad for gut biota, because we have, especially in American diet, we have so much sugar. The more sugar that goes down through the gut, the more good bacteria gets killed off and bad bacteria flourish. And so that is how the stress leads to microbiota changes. So the good versus bad is tipped towards the bad. Okay, now when that happens, it's a good bacteria that keeps the 2,100 square feet of your gut in a healthy, tight control, where it keeps the good nutrition to pass through to your system, and it keeps everything else in your gut. But when epithelial breakdown happens, epithelial breakdown means the good cells that are lining your gut, the control is lost, which means that under normal condition, there's a very tight control. As I said, the tight control means only the good nutrition gets into rest of your body system. But when it breaks down, because their bad bacteria has taken over, then undigested food and microorganisms, which could be bad bacteria that was in a battle with our immune system in the gut, those organisms, particles could be leaked out into our system. And and once it leaks into our bloodstream, now all kinds of immune systems starts being activated in your body in order to fight off what seems to be an enemy. And now the science is finding out with inflammation, with leaky gut, eventually it comes down to inflammation. And with that, just to give a little picture, when inflammation spreads everywhere, we have things like, which are so common in our society today: depression, anxiety, heart disease, autoimmune disease, cancer, or you name it, disease X, Y, or Z. Okay, so now the cells are kind of broken down and we have a leaky gut. What happens is the immune activation, now in the blood system, the whole body sees danger. There's all kinds of things that should not be in our blood system, in the blood. Activation by endotoxins. What this means is the toxins means like poison, toxic material that was created by bacteria that particles of the bacteria. When that bacteria fights with our immune system in our gut, it releases toxins, and those toxins, accumulation of those toxins cause leaky gut, and those same endotoxins activate the immune system for the rest of the body. And at that point, what happens is that cytokine is one of the our own immune system cells. It becomes activated. These cytokinins are messengers used by our immune system to communicate with rest of the body, including the central nervous system. It's alerting danger, that there is foreign particles, foreign enemy in the body. And that causes, each of these has a lot of very technical way how it goes from one to the other. And that causes blood-brain barrier breakdown. I'm not sure if you ever heard of blood-brain barrier. What it is in our blood circulatory system, the circulation, the small blood vessel, the smallest is called capillaries. Between the brain and rest of the body, the capillaries divide up into very, very small blood vessels. It's so small and so tight, almost nothing can pass through it other than blood cells to bring nutrition and oxygen to your brain. And what happens is when blood-brain barrier breaks down, that now you have nutrition and oxygen coming in. At the same time, you have toxins coming in. Maybe you have some bacterial cells coming in. So that your brain is affected. Your brain, things are coming in that should not come into your brain. And so the response for your brain is there's a glial cell activation. Glial cells are brain cells. It's not used for thinking and those kind of high function. What it is it's the immune system of the brain. They clean up the debris and they fight infection. So at that point, when this happens, the brain experiences inflammation, and a chronic activation compromises the neural function through inflammation. So if it was just an acute situation, this immune system in your brain will take care of it. But if it's chronic, because we are eating bad diet or we have continual stress every single day for days on and years on and continuously, it becomes chronic. At that point, it alters your brain, alteration in neuron transmitter levels. Okay, and also at the same time, we're going to see changes in synaptic plasticity. What this means is the connections of neurons are changed. And once this starts to happen, people start feeling different. It starts altering their behavior, because a lot of times our behavior behavior depends on healthy chemicals that our brains produce. So all of a sudden we realize that a person who used to have healthy brain chemicals now it's altered. And so what that means, they may perceive stress that's not there. Or they feel like they have to eat something because they are under so much stress. Like I've heard my coworkers saying, I have to eat a donut. That type of thing. You don't have to eat a donut. You're not hungry, but your body is calling for it because you're under so much stress. And you don't feel good, and maybe you might feel like, I have to see a doctor. I can't handle this kind of anxiety. So you go for anti-anxiety pills. And all of these medications, whatever medications you might be using, it again affects the microbiota. And so with that is more stress. So it becomes a vicious cycle. You have to stop it somewhere. So how can we stop this somewhere? And at any one time, we could encourage our friends and family. There are a couple of simple things that could dramatically alter this health microbiota to come back to being healthy. We all heard about fish oil, omega-3, and exercise. Increasing exercise and eating fish oil will provide much more comfortable place for good bacteria. So it will be, and at the same time, it's not the bad bacteria don't like it, but good bacteria like it. And another huge factor we can help to bring good bacteria back to the normal consistency would be eliminating high fructose corn syrup. I believe a year ago, I picked up a can of Campbell's soup, and it has sugar. The soup itself wasn't supposed to be sweet, but it has sugar in it. Then I picked up another one, and it had high fructose corn syrup. Then I picked up a loaf of bread, and sure enough, you know, you don't expect white bread to be sweet, but it had high fructose corn syrup in it. So if we can eliminate high fructose corn syrup, so what we do when we go shopping is we look at the label. If it says high fructose corn syrup, we don't touch it. And even, so you might say regular sugar is good, but even regular sugar, even organic sugar, you put too much sugar into your body, your good bacteria don't like it. They can't survive very well under a lot of sweets. So the thing is to avoid sugar as much as possible. And now I've gone over in a very quick way. Each of them will take me, to get into scientific detail could take me a whole week to understand how biochemically it goes from triggers to microbiota changes, and from there to here. Each one of them, there's so much biochemistry that alters our different symptoms. But in a very simple way, I gave you a simple picture of how this happens and how we can easily, well, it may not be that easy, but we can work on bringing good bacteria back into the scene. Okay, at this point, I wanted to bring to you a case study. Amber, I changed her name to protect the innocent, but she is an actual patient of Dr. Breland. And if you want to contact him, he has a website, brelandclinic.com, and he's in the East Coast. He gave me permission to use one of his actual case study to present to you how a functional medicine practitioner would go about treating the patient. When she came in, she had chronic yeast infection, chronic bacterial vaginosis. So she had yeast infection and bacterial infection. She had brain fog, debilitating depression, anxiety, interrupted sleep, daily headaches. She came in with 7 symptoms. I don't know how many times over the years a patient of mine would come in with 7 to 10 prescriptions. It would look something like this: yeast, anti-yeast, antibacterial, antidepressant, anti-anxiety, sleeping pill, headache pills, and a lot of times another form of antidepressant for brain fog. And so that's what I saw. I saw 7 prescriptions. However, what this doctor did is he collected all her past history from previous doctors. He noticed that she already was allergic to gluten and casein. Casein is a product that is in milk. And she did not know, or nobody told her, that she has to stop eating all gluten products and casein product. Maybe she was told, but she wasn't told how important it was for her to get away from it. She was taking them even to the point when she came in to see him. She had high antibody to her thyroid, low iron, and elevated red cell distribution width, and low normal immunoglobulin A. And I'll talk a little bit about that later. That's why this is very important. So at this point, before going on to do any more testing, he just stressed to her how important it was to get off of everything that had gluten and casein in it. And once she understood how detrimental it was for her health, she did get off of it. And then he decided to take a couple of more tests, because by looking at her symptoms, he realized it has to do with her gut microbiota changes. And so the doctor, Dr. Vreeland, ordered cytokine testing and stool testing. Cytokine is our own immune cells that is a communicator cell that alerts to the whole body that all kinds of immune cells needs to come together to conquer this unconquerable invaders. It's unconquerable because it's a continuously leaky gut happening. So let's see. So anyhow, through cytokine testing, he discovered that her candida, her fungal infection, with the fungal infection, she was not responding well to candida, but she was over-responding to bacteria, and there was an inflammatory response all over her body. Okay, so how did he figure out that she was not responding well to candida? When he looked at low normal immunoglobulin A, he realized she must have been fighting some kind of infection over a long period of time. When you have acute infection, which means something happens right now, your body pours immune cells to there to kill off that invader, that enemy. But if it's continuously happening over the years, 4 years, 5 years, 10 years, your body loses energy. I mean, it has to spread all its resources everywhere. So that immune cell becomes really low. Even if he was seeing a lot of candida, this immune cell that would normally eat up candida was very low. So at that point, he realized she had candida yeast for a long, long time. And then there was over-responding to bacterial portion of the infection. Over here we have bacterial infection. So he knew right away that he has to take care of infection first. Okay, and with stool tests he realized there's good bacteria was very low and bad bacteria was very high. So how did he treat this? He's going to tackle the infection and take care of the leaky gut. So, so he put her on Biodemulsion Forte. What it does is it fortifies the cell so it will become less leaky. He put her on oil of oregano extract. It's a very potent antimicrobial to take care of the infection of both yeast and bacteria. He put her on N-acetylcysteine, which is very strong antibiotic to battle H. pylori, which was another bacteria he found in these testing. And then he put her on Dismuzyme. It's for use for viral and bacterial infection. It's for inflammation, for immune insufficiency, and gastric inflammation, which she was experiencing in this arena. And then he also put her on Bio-HPF, and it has a strong activity against H. pylori bacteria, dangerous bacteria which she had. It's also good for gastric, bacterial, and parasitic infection and toxic bowel. So he was concentrating on two things: eliminate yeast, eliminate bacteria, and strengthen the gut, leaky gut that was happening. After first month, her bacterial vaginosis yeast infection was a lot better. Brain fog and depression was unchanged. What's happening is your body is tackling for what is most dangerous. Second month, doctor added vitamin A. It plays major role in improving epithelial barrier function. Again, to help heal up the leaky gut all over, all 2,100 square feet. POA Phytolin is additional antimicrobial. Neutrophil Plus is an immune booster. And folate, at this point, he's adding something to help strengthen the brain. Okay, third month, all yeast and bacterial symptoms were gone. Now, she had this was chronic. It may have lasted years. Now, third month, all the infections was gone. She said she had 20% improvement in brain fog and depression. Now her mental symptoms were improving. So he continued to monitor small changes for 2 months. And then at that point, he started with very, very good pre and probiotic. Once he got rid of all this dangerous infection, then he added probiotic to really replenish good bacteria in full force. Fifth month, she felt she was doing great. Her headaches were completely gone. She had daily headaches. Again, she had these problems for 4 or 5 years. Her anxiety was improving, and the depression was improving slowly but surely. 8th month, she said, I feel amazing. My brain fog is almost gone. Whatever was in my gut is leaving. Actually, it has left. And I have been decreasing sertraline, which is actually antidepressant pill, so she must have hung on to that from her previous doctor's prescription. But she's decreasing it. I feel very good. Thank you. So she's almost completely restored, and he has not put her on a sleeping pill, anxiety pill, depression pill. He has not touched that other than trying to heal the root problem. And so she may, in a month or two from that point, she may be walking around like she hasn't experienced in many, many years. The next topic I'd like to do in a few weeks is gut in relations to autoimmune disease. Thank you for watching.